Have you ever made a big purchase, big buying decision on something that's really going to impact your life, and then you went to sleep? You woke up the next day and you thought, what in the world did I do? It's a very common problem. It's called buyer's remorse, and a lot of people have this. They want to rethink what they just did the day before. The problem is with Medicare, when you wake up December 8th, it's too late to redo what you did in the enrollment season if you're on a Medicare Advantage or a Part D drug plan. Today, I'm going to talk about a do-over period where you actually can revisit that decision. But first, in order to remain compliant, my name is 𝗲𝗄𝗏 𝗏. I'm a licensed insurance agent specializing in the world of Medicare for the last 28 years. There are different enrollment periods with Medicare. When you're turning 65, you've got your initial election period. Or if you've been working at a group plan with more than 20 lives, you can defer starting Medicare. When you decide to start Medicare, then you let Social Security know that you want to start Medicare Part B. You also have the same rights as you did when you turned 65, your initial election period, 3 months before, the month of, and 3 months after. Then you can choose any plan you want to, a Medicare Advantage plan, a Medigap, or a Medicare supplement plan. The world is your oyster, and any drug plan if you want to go that route. But then there are some other periods that you should know about. If you delayed Part B and you did not have a qualifying employer plan, then you might be facing a penalty. If you waited to get onto Medicare and you had no other qualifying coverage, every time you wait 12 whole months, you have a 10% penalty added to your Part B premium. And that 10% per year lasts for the rest of your life. Not a good thing to do. You have a short period of time where you can join Part B every year. You can't just do it whenever you want if you missed those periods I mentioned before. So here's the biggest enrollment periods with Medicare. October 15th through December 7th, that's when you can pick your Medicare Advantage plan that then starts on January 1st of the next year. Again, October 15th, it starts and then ends on December 7th. Whatever you enrolled in last, let's say you made 3 different choices during the annual enrollment period, the last one that went in is the one that locks in on January. Here's the part most people don't know. When January rolls around, now you've had a chance to review your summary of benefits. Now you get to see those gaping holes we often talk about and things that need to be patched and filled on your Medicare Advantage plan, namely cancer and often dental insurance, vision insurance, and those kind of things, because while Advantage plans sometimes say that they offer dental benefits, when you look closely, especially for 2026 and beyond, those benefits have been pared down. They used to be real dental benefits, and now they may be just a cleaning with a very, very small finite HMO directory. So a lot of people now take the opportunity, once January starts, of filling those holes, especially with regard to cancer. We've talked about it many times. Cancer is one of the biggest holes in Medicare Advantage because they will require you, in most all cases for cancer treatment, you have to pick up 20% of the bill all the way up to your max out of pocket. And again, because most of these are HMOs, they have a limited network. So you can't just go to any cancer treatment center you want to go to. MD Anderson, Mayo Clinic, Cancer Treatment Centers of America are not typically covering you if you're on a Medicare Advantage plan. Looking at your summary of benefits for your Medicare Advantage plan for the new year, you might realize, oh no, Chris was right. If I have chemotherapy, if I have radiation, I'm going to have to pay 20% of that big, big bill out of my pocket and go to an exclusive small network. Whereas if you do have cancer insurance, which is a separate plan, not available in California over the age of 65, why, I just don't know. But if you have a cancer plan, then you can apply $25,000, $50,000, or even more cash benefit toward your cancer coverage to cover those out-of-pocket costs and to even get cancer coverage treatment in places that would not be approved by your Medicare Advantage plan. So January rolls around and you're looking at your summary of benefits and you're thinking, I need to do something. Or you find out from your doctor's office, this happens so often, they'll notify you, we've been a part of whatever company's network, Humana, Aetna, United Healthcare, whichever one, but because of contract negotiations or whatever, we're not going to be in it for the new year. And remember, these network changes can happen any time of the year because their contract, the provider contract, is not the same calendar year as your contract with your Medicare Advantage plan. Or worst case scenario, which happens with millions of people every single year, you didn't pay attention with what was happening with your Medicare Advantage plan, and it suddenly rolled over into a new plan. And like we've been trying to warn for the last 6 months, these benefits have changed drastically. And if you just expected your old benefit to be the same as the new benefit, you're going to be sadly mistaken. And what you should have done is compare the benefits during the annual enrollment period. I know what you're thinking. I tried to call my agent, or I tried to call your office, or I tried to book an appointment, and it was so crowded because literally millions of people had lost their Medicare Advantage plan for the new year that you may not have even been able to get an appointment. Totally understand that. But here's the good news. There's yet another period where you can have a do-over and you can change your Medicare Advantage plan from whichever one you ended up with for January, because either through a decision or a lack of decision, you ended up on a Medicare Advantage plan of any kind for January 1st. It kicks in. Now you have another period. So you've got January 1st to March 31st. They weirdly call it an open enrollment period, but it's not open. There are some restrictions here. For instance, if you don't have a Medicare Advantage plan, you can't just go get one. This is only for people who already have a Medicare Advantage plan. What you can do is you can switch to another Medicare Advantage plan during this period. Again, January 1st to March 31st. Another choice you could make is to go from your Medicare Advantage plan back to original Medicare. You can do that, leaving behind the network restrictions and all that of your Medicare Advantage plan. Yes, you can let go of the whole thing, go back to original Medicare, and because you're doing that, you can pick up a standalone Part D drug plan. The benefit there is your standalone Part D drug plan will be tailored to your exact medicine cabinet, so their formulary can match up with your drugs and give you the best possible protection because it's customized for you. Many times people don't discover until they get into the new year that their Medicare Advantage plan, although they're saying it's an all-in-one plan, it's fantastic, they didn't stop to look at the drug implications. And again, for 2026, those formulary lists have gotten much, much smaller. Because remember, your out-of-pocket protection, that was part of the Inflation Reduction Act, does not apply, does not help you, does not give you a cap if the drug is not listed in the plan's formulary. So those formularies have gotten much smaller. So again, you could choose to go to another Medicare Advantage plan, maybe with a better formulary. You could also choose to go back to original Medicare, drop the Medicare Advantage, and just pick up a standalone Part D drug plan. You need something else. Why? Because original Medicare is fantastic. It lets you go to any doctor, any hospital in the country that accepts original Medicare, which is just about everybody. The small caveat of original Medicare is you're exposed to 20% of all the Part B charges. That's pretty much everything except being admitted into the hospital. That's your outpatient surgery, your x-rays, your MRIs, your CAT scans, all the things you have done in the doctor's office or an outpatient clinic. All that, the majority of costs on Medicare is under Part B. And that's the part that you have an unlimited obligation to pay 20% on. There's no max out of pocket for that. And that's why millions of people choose to have a Medigap plan to fill in the holes and pay those Part B costs. The most typical plans are Plan G and Plan N, Medicare Supplement. And we have material we can educate you on what those are. Here's the problem though. If you're not new to Medicare for the first time, or you don't live in a state that has guarantee issue rules, like a New York state, for instance, when you leave your Medicare Advantage plan and you go back to original Medicare, most cases, you have to go through underwriting. What does that mean? It means you have to simply answer some health questions. Are you using a wheelchair, cane, or walker? Do you have a debilitating disease? Do you have diabetes that's way out of control? Do you have this condition like cancer in the last 2 or 3 years? Do you have this condition? And we go through those conditions and find out which company would accept you on the Medigap or Medicare Supplement plan. For all those people, the millions of people who did lose their plan through no fault of their own, you have a special guarantee issue period. And that guarantee issue period comes through February. So if you did nothing, you lost your plan, you don't know what to do, and that affects you, you still have a choice. You can go to original Medicare and you can get a Medicare Supplement plan, guarantee issue. I'll let you know that most all states and most all companies, if you have a guarantee issue opportunity, what we call the golden ticket, because you were dropped from your Medicare Advantage plan, and now you say, I want a Medicare Supplement plan. Insurance agents like me, we don't get paid a dime. Why is that? Because the insurance companies have rigged this system by which if they have to take somebody through guarantee issue and they can't underwrite you and they can't ask you any health questions, by golly, they're going to get their meat somewhere and they take it from the agent commission. So there is typically no agent commission whatsoever if the agent is going to put you on a guarantee issue plan. That's why agents won't clamor for your business if you lost your Medicare Advantage plan and now you have this golden ticket, because we simply won't get paid. This year, agents are getting not paid more than ever. Sounds like a double negative, but it's really not. What that means is if you were on a Medicare Advantage plan, you lost it, and you wanted to go to a Medicare supplement, that agent's not going to get paid. If you're on a Part D drug plan and you want the agent's help, but this year, we couldn't even enroll you in those plans because the insurance companies hid those enrollments. They took that opportunity away from the insurance agent, leaving millions of people to fend for themselves on Medicare.gov. Yeah, it's been a challenging year for the insurance agent, no question. But I just want to leave you with this. If you're on a Medicare Advantage plan and you found out that it's not all it's cracked up to be, you have a short window, now January 1 through March 31, where you can get the benefit of an insurance agent to help you line up your doctors, your hospitals, and your drugs to find a plan that most appropriately fits your particular needs. You can get the expert opinion and expert help, especially in the world of insurance, for free. You can get somebody with 20 years experience to guide you through the best plan. We know which companies treat people better, especially on a state-by-state basis. That's the benefit of having a brokerage that has all 50 states. We see trends coming before your local agent down on the street even knows it's going to happen, because we see these waves happen across the country. So you can literally get the benefit of experience for no cost whatsoever. So if you're on a Medicare Advantage plan and you'd like a second opinion, or you've just discovered this plan is not going to fit your needs, and what did I do? You've got another period here. January 1 to March 31. January 1, let's say you discover your plan is not going to meet your needs. You need something to happen. You need to get off that plan as soon as possible. Maybe your doctor's left, the hospital left, the drug formulary that you now have before you does not match up with your drugs. So you're going to be paying those things completely out of pocket, or a super high tier, which means more money out of your pocket. If you do, and you go through an agent, which I recommend to do, if you do that in January, anytime in January, your effective date of the new chosen plan is February 1st. If you do that anytime in February, your effective date of the new plan will be March 1st. And in March, if you make that decision then, only then to discover you need a new plan, you can do it anytime in March, and your effective date will be April. That effective date applies if you go from Medicare Advantage back to original Medicare, dropping all Medicare Advantage, and you want to pick up a Part D drug plan so you don't have a penalty for the rest of your life. That's the problem. If you don't have a drug plan at all, and then 1 year you say, you know what, I'm taking enough drugs now, I need a Part D drug plan. You go pick it up later, you're going to have a penalty for every month that you didn't have a Part D drug plan. So it's always best advice to have a standalone Part D drug plan, and your effective date for that also, if you're going through this new period, is the 1st of the next month, but you only have January, February, and March to make those elections. If you'd like to look at the underwriting to see what plans are available to you, and I can guarantee you one thing, if you go through an independent agent, you'll have access to more plans than you would if you just look on Medicare.gov, especially in the world of Medicare supplement, Medigap plans. That's supplementing original Medicare, so you have the freedom and the flexibility to go anywhere you want to. Those Medicare supplement plans are highly specialized, and it generally takes an independent Medicare specialist to let you know what all the plans are available. Many times we hear from people who say, I just got a brochure in the mail and I just went with that. And that's when we find people that end up on goofy plans like Plan K, Plan L. They're like, I had no idea what I was buying, but it looked good because I got a brochure in the mail. If the experienced help from somebody is absolutely free, why not take it? Why not have the experience of thousands of people? Those are test cases that you don't have to go through. You can benefit from their experience without even paying a dime to do so. So let an experienced agent help you. Again, this period is a finite opportunity, January 1 to March 31, for a do-over of Medicare Advantage or to go back to original Medicare. But don't just call your Medicare Advantage company and say, you know what? I'm done with you. I want to go back to original Medicare and I'll pick up a Part D drug plan. Unless you first consider and weigh the cost and the opportunities that may be there for a Medigap plan first. The process is you'd want to go get approved for a Medigap Medicare supplement plan first, go through the underwriting if it's required in your state, and we could tell you that. And if it's required, get the approval first before you pull the ejection seat on your Medicare Advantage. The worst thing that could possibly happen is you already tell the Medicare Advantage plan you're out of here. Then you apply for a Medigap plan later, only to find out you did not get through underwriting, leaving you with absolutely nothing, no coverage whatsoever, exposed to an unlimited cost on your Part A and your Part B. You don't want that. Get some professional help. This is one of the most important decisions of your senior life. I'm 𝗀𝗄𝗧 𝗕. Thanks for watching.